You can start.
Okay, so what are the aspects when we talk about of evidence-based decision making? Okay, when we talk about aspects, first one is methods to generate high quality evidence. To fall back to evidence, you need to have good evidence, right? You need to generate some high quality randomized control trials, and from those you need to generate high quality meta-analysis, systematic reviews. Okay, now for this what do we have? We have statistical tools at our disposal. Okay, statistics, what do they help us in identifying? They help us in identifying whether something is clinically relevant or not. आपने दो ट्रीटमेंट करे, ठीक है? For example, yeah, you take Vista coronally advanced flap. You did that for multiple gingival recessions. Now you want to figure out which one of them is better, which one of them is clinically relevant, statistically significant. So you apply these statistical tests or tools. Okay. Now there are ways of assessing evidence and applying it. Now how do you do that? For that you need to be, of course, technologically or technically adept. You need to know how to search online. You need online searching skills for that. Okay, for skills for finding relevant information, not just any information. Google search तो एक बच्चा भी कर लेगा. 5 साल के बच्चे को भी आप Google खोल के दे वो कर लेगा. But you need to know which all sites to go for, what all search bases. Okay, what all libraries, for example, Embase, Medline, Scopus, Web of Science, Google Scholar. Okay, even after that, you need to analyze and critically evaluate the evidence that you got. Then you need critical appraisal skills. Critical appraisal skills क्या होते हैं? Anyone?
To be able to critically evaluate all of the studies or
Consult for RCTs and Prisma for ONSRs.
Yes, so we have checklist in place because people got very confused. How to identify that this particular RCT is a good one or not? How to identify whether this is legit or not?
केस स्टडीज में हम लोग और एक देखते थे ना क्रिटिकल एनालिसिस में
एक और है केस स्टडीज
There is care analysis.
केयर एनालिसिस
Okay, but अब ये चीज तो चलो हो गई. In order to find relevant studies, Shubha, what do we need? We need to have a focused question. Okay, to get good answers, to get the right answers, you need to ask the right questions. If you're not asking the right questions, you will not get the right answers. Okay, so one very important part of that is asking the right question. So how do we ask the right question?
We formulate a PICO.
You formulate a PICO. For that you need to have a clinical question. You need to have a problem at your hand. Okay, the example which is given in Carranza that they have taken is basically clinical application. Yeah, so they've taken a 13-year-old patient. Okay, who because of trauma. Okay, I'll just read it out to you. The clinician received a call from parents of 13-year-old female patient who had been struck in the face with softball. Sad. She was being examined by paramedics in a town 30 minutes north of the dental office. The paramedics cleared the patient of any head and neck injury and other medical issues and informed the dentist that the dental trauma was the primary injury. Now the dentist and his assistant met the parents and patient at the office 45 minutes following dental trauma. The patient's teeth remained in her mouth following the incident. Then the preference of the patient and the parents was to do anything to keep the teeth. They wanted to keep the teeth. After the site was cleaned and irrigated, it was apparent that there was complete avulsion of maxillary right central incisor of the socket and lateral luxation of maxillary left central and lateral incisor. In addition, there was alveolar bone fracture, partially encasing the roots of maxillary left central and lateral incisors. So the clinician replanted the teeth and reapproximated the gingival tissue with sutures. Fine. Now a stable and accurate ribbon and flowable composite splint was placed and the radiograph was taken. Fine. So clinician did what he had to. He gave first aid. वापस से reimplant करा. Print को लगाया. Sutures दिए. But now the next question comes is, for how long does the clinician need to keep the splint? Or whether the clinician should go for RCT or not, root canal treatment or not. Now that is a question. So here what will help us is PICO criteria. Okay, so what is Pico? Pico is basically, you can say, a sort of format in which you ask question. When you ask question, your question is focused, okay, and also it basically serves two key purposes. First is it forces the clinician to focus on the issue that they have. Okay, the task at hand, the issue at hand. It forces you to focus on that. Second thing is it helps in facilitating the next process. The next process is you go online and you search. So first you focus on the issue, then the next process is going online and searching. So you have a focused question now. Okay, then it also directs the clinician. Directs the clinician where? To identify clearly the problem, the results and outcomes related to the specific care provided to the patient. Okay, so this helps in identifying the search term and conduct an efficient search. Now in this case, what happens if we look at the outline or the events, first is you would receive a call from the parents, okay, then you did the physical examination and you took the medical history, then you saw that there is a luxated or avulsed tooth, okay, retained in patient's mouth post-trauma. After that you re-implanted the avulsed tooth and luxated tooth, then you splinted the tooth or teeth with a ribbon flowable composite. Then we have two questions, okay. First is when do I completely extirpate the pulp, and second is for how long do I keep the splint. Okay, so for this what will be the Pico criteria? Now for that we need to, what is Pico? Pico is, P is patient or population. You identify the demography, you identify the patient. Then I is the intervention.
Or exposure.
Comparison, or sometimes it's not there also. You don't have to always compare, okay? But yeah, comparison. And O is your outcome. Okay, so in this case, if we look at it, what is going to be your question? In case of how long do the teeth need to be splinted? What will be the Pico question? Try it, guys. So we can take it for a patient with dash. Patient with, as in we identified what the patient is suffering from or the condition. For a patient with dash, will as in will particular intervention as compared to whatever we are comparing with. Okay, increase or decrease or provide better in doing any particular outcome that we are looking for. Okay, so in this case, when we talk about the Pico question for our splinting, how long do we need to splint it? It will be for a patient with replanted avulsed and luxated teeth. So you have covered the patient part, what the patient is suffering from. Second, will short-term splinting as in 7 to 14 days. Okay, as compared with long-term splinting. So here he has compared short-term splinting 7 to 14 days as compared to long-term. That is your 2 to 4 weeks. Okay, increase the likelihood of a successful tooth integration, okay, and functional periodontal healing. Tooth integration to the bone again, to the socket, okay, and healing. We're talking about healing here. And decrease the development of resorption and ankylosis. So resorption and ankylosis are the two most common, and we don't want that. The most, you can say, you want to avoid these kind of outcomes. Whenever there is an aversion or you can say a trauma to a tooth, the high chances the root will either resorb or it will ankylose. Okay, so we have a focused question now. Now after that, you go ahead and you search the answers. You go to PubMed, you go to Google Scholar, Web of Science Scopus, you go, okay, and you search and look for full text articles or relevant articles. Okay, once you get those full text articles and relevant articles, you need to critically appraise the article. How do you do that? Journal club. You do that by applying those checklists that we have. Okay, so everybody understood what is Pico? Pico समझ में आया? कैसे use कर रहे हैं वो समझ में आया? Why are we using it? Why are we using Pico? Anyone? हाँ.
First, what the patient prefers. Like they want to save the tooth.
They want to save the tooth, yes.
And then we have to do the treatment.
You have to do the treatment, of course. Then
we'll see according to the situation, criteria, everything, which treatment is better.
Yeah, true.
And then outcome, how from the treatment, what are the outcomes? What are the things we want and we want to avoid?
Perfect. So Pico does mainly 3 things for you. Okay, first is focus. Second, it facilitates. And third is there. Focus on the situation, on the question at hand. Facilitates in conducting an online research. Directs you to the answers. Directs you towards the solution. This is what Pico does. That's why Pico is very important over here. Okay. Directs in clinician in identifying the strategy which clearly solves the problem, helps in identifying the results and also the outcomes related to a specific cause or specific area that you're looking for. Okay. Now, of course, whenever you go for buying something, like for example, you're going to buy a chair or you're going to buy a car, okay, being a good consumer, you'll always check for the quality. ऐसे ही तो हम जूते भी ऐसे नहीं लेंगे. Okay, we check for the quality, उसे एक बार पहन के देखते हैं, we compare it with others, right? So here also you have to be a competent consumer. You don't just go ahead and you find the first article and you like, हाँ इसका अच्छा लग रहा है, यही करते हैं, ये सही लग रहा है, results तो बहुत ही अच्छे हैं. You never know, you might have skewed the results. Okay, so to be a competent consumer, you need to have certain tools at your hand. Okay, so a study you have to identify whether it is limited. Okay, whether if it's of weak quality or if it is poorly conducted. You can identify from a few of the points, like for example, many times what happens in RCTs and all, okay, if the patient, you can say inclusion criteria or the number of patients they took was around 20. 20 is the minimum number of patients that you should take. So, but just to be on the safer side, they took 25. It's not very I would say it's pretty common for patients to drop out before the study actually gets over. Out of 25, at the end you'll have some 23 or 22 patients. Okay, but imagine a study which is saying we took 20 patients, 20 were required and 20 actually went ahead with the study till the end. दाल में कुछ काला लग रहा है, थोड़ा. Okay, so these are small things that you can, once you start evaluating the evidence, you would realize there are certain things which do not make sense. Okay. Now sources. What are our sources? Our sources are of 2 types, primary and secondary. So primary sources are studies conducted first hand, your RCTs, your case control studies, cohort studies, okay, retrospective, prospective studies. These are first hand studies.
Make that evidence-based strategy.
Okay.
It will be good for people.
So when you talk about hierarchy of evidence, okay, first you need to know what 2 types of evidence we have. We have primary and secondary. Primary is your first hand, you conduct that study, that is your primary evidence. Secondary is from these primary studies you are sifting through the studies and you're finding the best available evidence and you're compiling that. That is your secondary evidence. Okay, when we talk about hierarchy, okay, on top what do we have?
Meta-analysis.
Are you sure?
Clinical Clinical
CP.
Clinical practice guidelines. Okay, you have CPGs. What are CPGs? You must have
After a lot of research that is done, they produce a set of guidelines for you to follow and it becomes part of your daily practice or clinical.
Yeah, for example, European Federation of Periodontology, Sanzitel, they have given guidelines of how to manage patients stage 1, stage 2, stage 3 periodontitis. Okay, so those are proper clinical practice guidelines. After going through a lot of evidence, going through a lot of cases, they realize that this is the perfect protocol. If a patient with so and so, like for example stage 2 grade B periodontitis come to you, then this is the protocol that you can follow. Of course, it cannot apply to every patient, but you get an idea. This is what I have to go through. And these are the steps that I should follow. Okay, so first is your clinical practice guidelines. Second is
Systematic
meta-analysis. Meta-analysis. Now third is RCT. Or then after that, fourth is
Cohorts, not case controls. Cohorts.
Cohort studies.
Prospective, retrospective.
Huh. Cohort studies. Then after that you have your
Case control.
case control. And then
Case
last
series and reports and last
case report series, and then you have your I saw that, Shubha, I saw that.
शुभम 2 महीने से यही टॉपिक पढ़ रही हूँ.
Then you have expert opinions, literature reviews, okay, and animal studies. So that's all that comes here, all of it. The most important one is clinical practice guidelines, your systematic review and meta-analysis. But here also, not every systematic review is a good one. Okay, even though there are certain steps and guidelines in place, how would you make sure that the person conducted in the right steps, followed the right protocols?
Was not biased.
Not biased. Also, the one thing about systematic reviews is that everybody, whenever you conduct a systematic review, you have to systematically mention that I followed this was a search strategy, then I obtained these results, then I concluded or took out this data, then you see the study characteristics, okay, qualitative and quantitative evidence, and after that you apply those statistical tests or tools. You conduct a meta-analysis if you want to. Now, to check whether you followed everything thoroughly, if I also followed the same set of protocol, the same set of steps that you have taken, I should also obtain the same result. That is the point of systematic review. That's why it's called systematic, because you are going in a systematic manner. Okay. So this was about it. Then after that we'll see what all we're left with. We've covered most of it. Okay, evidence. Then searching, you have your databases such as Scopus, Web of Science, everybody knows that. Okay, appraising the evidence, we figured out that we have certain guidelines such as consort guidelines for RCTs. Okay, then we have PRISMA, preferred reporting of items for systematic reviews and meta-analysis, that is for systematic reviews. Then there is also critical appraisal skills program. Okay, so this particular program, the site is mentioned in Carranza, you can go check it out. This is to review RCTs, SRs and several other types of studies if you want to enhance your critical appraisal skills. Okay, so yeah, this was all about evidence-based decision making. Did you guys understand? Questions?
Questions.
Can you please explain the last part of the chapter? What is like the analyzing and forming the outcome? What are the steps for that?
Applying the evidence-based
Exactly.
decision, dentistry in action, evaluating the outcome. So here, I'll have a look. Okay, so once you have applied a certain, for example, certain treatment, here he went through articles, okay, he found out the time that he should actually put the tooth to split. For example, let it be like for 7 to 14 days, you should split the tooth. That's what he figured out from the evidence. Okay, now after that, he has to analyze, you have to analyze whether it worked or not for you. Analyze and evaluate. Okay, so that analysis lies with you. This is about it. It's not too much. It's just applying the evidence. Once you apply anything, that like for example, if you remember that Bloom's taxonomy chart that we studied, first is your remembrance. Okay, that is a different one, but yeah, that also goes from apply, evaluate, analyze. Okay, whenever you apply anything, after that you evaluate whether it worked or not. Then you analyze and you compare it with other techniques. Compare it with the same particular evidence, same particular article that you referenced. What result did they get? Did I get the same result? Was it along the same lines? If not, then why? Then you retrace your steps. You check. Did I go wrong somewhere? Could I have improved somewhere? Or maybe are their results skewed? Okay, that could also happen. That could be possible. Maybe the article that you referred, that you used or referred was not up to the mark. Maybe it was of poor quality. That's why you did not get the relevant result or the result that you wanted. Okay, so this is critically analyzing your own results based on the.
There is no tools involved in that here.
No particular tools involved here.
That's
Yeah. This is basically your own judgment. Also, you have to be very careful whenever you are using an RCT or falling back on an RC or any evidence. You have to check for the demography. You have to check for confounding factors. Okay, their exclusion criteria. So these are small things that you have to keep in mind, which of course will get better as you start assessing evidence. Okay. So that was about it.
Can you elaborate a little bit on JBI tools and other tools used in critical appraisal?
JBI tools.
JBI tool use किया जाता है ना?
I don't have much idea about it. I'm not going deep into it.
It's okay. ठीक है.
Mine is a little limited to the tools that we use for particular studies such as consort, guidelines.
नहीं, okay, ठीक है, वो तो
If you have idea, you can come and explain.
I don't want to.
I want to.
Come.
I don't know. इसलिए तो पूछा question. It was a dumb.
But I'll check it out.
Yes.
I'll look through it and let you know if I find something.
नहीं, chapter 1 में दूसरा.
Okay.
Okay.